Hi everyone, I'm Morgan Allen. I'm from Hillcrest Family Services, and today we're going to talk about contraception. This video contains subject matter that may not be appropriate for a younger viewing audience. We ask that you are aware of your surroundings when watching the video and to find a secure location if watching in an area around youth. Thanks! Now, the topic of contraception may feel awkward or funny, and that's okay. It is funny. It's okay to laugh. I'd rather you feel uncomfortable now watching this video than get into a situation where you've had sex and you're unprepared and you have a result that you weren't expecting. So it's okay, laugh, relax, and watch and rewatch this video as many times as you need so you can learn everything you need to know about contraception. Let's get started.
What is contraception? Contraception, or birth control, is methods of protection used during sexual activity to prevent unplanned pregnancy and, in some cases, sexually transmitted infections. You might be thinking, why is contraception so important? Well, honestly, because change is hard, and unexpected change is even more difficult. Birth control helps protect against unplanned pregnancy, and some birth control can even do other things, such as regulate menstruation, reduce cramps, and protect against sexually transmitted infections, or STIs.
Before we begin, I want you to think of all the forms of contraception that you might already know. Which of these forms of contraception do you think is the most used by Americans that are your age? Now, which form of contraception do you think is the most effective when preventing pregnancy? Is this the same birth control, or is it different?
According to the CDC, the Center for Disease Control, from 2015 and 2017, studies reported females ages 15 to 19 years old used condoms the most as a contraceptive method, followed by the withdrawal method, then oral contraceptive pills. However, the implant, also known as Nexplanon, and the IUD are some of the most effective methods, sitting around 99% effective, behind abstinence, which is 100% effective in preventing pregnancy. Today's use of the word effective refers to how well the birth control method prevents pregnancy. The right side of the chart shows you, on average, how many times sexual activity resulted in a pregnancy when the use of the contraceptive method was in action. We will go in depth about each method of contraception regarding how the methods prevent pregnancy and their possible side effects. We are going to cover 19 methods of birth control, some on the chart and some are not.
19 different contraceptive methods. That's a lot. Some methods are going to work better for different body types and different lifestyles. So a person may try several different types of birth control throughout their lifetime, depending on the pros and cons of that method and what works best for them. Some methods are going to vary in their side effects. Maybe they have additional benefits and they might just work better for you. If you start using a birth control method and you don't like how it affects your body or your lifestyle, or maybe it causes major health complications, it's important to notify a medical health professional and talk about which options might better suit you.
Let's get started with the method that best prevents unplanned pregnancy. Often not recognized as birth control, abstinence is the most effective birth control method. Today's definition of abstinence means not participating in any type of sexual activity with another person, including vaginal, anal, and oral sex. Pregnancy is possible when a sperm cell from semen enters the vagina and finds an egg.
Deciding to participate in zero sexual activity eliminates the risk of having an unplanned pregnancy altogether. We want to make this clear because abstinence can have different meanings for different people. Anybody can be abstinent, no matter age, gender, sexuality, or prior sexual experiences. Abstinence can cost $0, yet takes strict willpower to be 100% effective.
Let's get started with the next most effective forms of birth control.
First, tubal ligation. This method, also referred to as getting your tubes tied, is a birth control method that blocks the fallopian tubes in a person with a vulva. This process prevents ovulation, which is when an egg leaves the ovaries and travels to the cervix as it waits to be fertilized by sperm. The fallopian tubes can be cut and tied off, or blocked by a clamp or small tight ring to prevent pregnancy.
Tubal ligation is 99% effective when it comes to preventing pregnancy. It's labeled as a sterilization method because this procedure is permanent. Now, tubal ligation can cost anywhere from $0 to $6,000 depending on what insurance can cover.
Similar to tubal ligation, a vasectomy is a permanent sterilization procedure, but performed on people with penises. The vas deferens are cut or blocked with clamps, which prevents sperm from leaving the testes.
A vasectomy is 99% effective. The procedure does not change ejaculation for this person. Ejaculant looks and feels the same, just doesn't contain any sperm. Now, a vasectomy can cost anywhere from $0 to $1,000, depending on what insurance can cover.
Let's get into the most effective contraceptive methods that are not permanent. The implant, also known as its brand name of Nexplanon, is a small thin rod containing hormones that are released into your body once it is implanted in the arm. The hormone progestin stops ovulation, so it stops eggs from being released to be fertilized, and also thickens the mucus in the cervix that prevents sperm from swimming to an egg. The procedure of getting the implant is done by a doctor and should not cause pain other than the sting from the numbing shot that is given before the implant is inserted.
The implant can stay in the arm for 5 years, but can be taken out and replaced when needed. The cost is anywhere from $0 to $1,300, depending on insurance. Common side effects of the implant include spotting between periods being heavier before becoming lighter, and periods even disappearing completely, which are all normal to hormonal birth control. Other positive side effects of birth control methods that release hormones include the easing of cramps and PMS symptoms, as well as reducing heavy periods and making periods more regular.
The last birth control method on the highest row of effectiveness is the IUD. The IUD, or it stands for intrauterine device, is a small piece of flexible plastic that sits in the uterus. There are 2 different kinds of IUDs: the hormonal IUD that contains hormones, progestin, that stops ovulation and thickens the mucus in the cervix. And then there's the copper IUD, known by its brand name of Paragard, that contains no hormones but is wrapped in copper that is toxic to sperm and prevents sperm from reaching an egg.
Both types of IUDs are 99% effective when it comes to preventing pregnancy. The hormonal IUD can last anywhere from 3 to 5 years depending on the brand. There's only one brand of the copper IUD and it can last up to 12 years. The cost of both kinds of IUDs are anywhere from $0 to $1,300 depending on insurance. Now, when the IUD is initially inserted, there may be some cramps or light spotting, which are very common within the first few months. Now, the side effects of the IUDs are completely different when it comes to hormonal IUD and the copper IUD. The hormonal IUD is similar to all other birth control methods that release hormones. Now, this can include spotting and periods eventually disappearing altogether. The copper IUD does not contain hormones. So it does not have the positive side effects like reducing cramps or easing up PMS symptoms, but it can include having periods more be irregular and more spotting in between your periods.
All of the methods we have talked about so far are from the first row of effectiveness at 99% effective in preventing pregnancy. Our next birth control method isn't on the chart but lies in between the first and second row at 98% effective.
When a new mother breastfeeds her baby every 4 hours during the day, every 6 hours at night, and only feeds her baby breast milk, her body naturally stops ovulation. This method is called LAM, lactational amenorrhea method. It can last up to 6 months after the mother has given birth and stops both ovulation and periods. It costs $0, but can be extremely time-consuming and exhausting to exclusively feed a baby breast milk. So it might be the mother's best interest to use another birth control method, such as condoms, while using this method.
The next birth control method is 94% effective, and it is the shot, also known as Depo-Provera. The shot contains the hormone progestin, similar to other hormonal birth controls, and stops both ovulation and makes cervical mucus thicker. The shot is to be taken every 3 months and is most effective when taken on time.
Common side effects of the Depo shot can include light spotting and slight weight gain, and periods disappearing completely, similar to other hormonal birth control methods. The shot can cost anywhere from $0 to $150 depending on insurance.
Next, we have the ring. The ring, also known as the Nuva ring, is a small flexible ring that releases hormones, progestin, and estrogen to stop ovulation and thicken mucus in the cervix. The ring sits in the vagina, releasing hormones into the vaginal lining. It does require a prescription and needs to be replaced every month.
The Nuva ring can cost from $0 to $200 depending on what insurance can cover. Common side effects can include sore breasts, nausea, spotting, changes in periods, again, similar to any other birth control that release hormones.
At the same effectiveness rate of 91%, the patch is a prescription-required method that releases hormones through the skin to prevent pregnancy. The hormones estrogen and progestin stop ovulation and thicken cervical mucus to stop sperm from reaching an egg. The Xulane patch must be replaced every week on time for it to work at its best.
Common side effects from the hormones can include nausea, sore breasts, spotting, which all should only last the first few months of the patch. The patch can also cause a slight irritation on the skin where it is placed, which can be the stomach, the back, the upper arm, or the butt.
The last method on that middle row of the effectiveness chart is oral contraceptive, or the birth control pills. The pills can be 99% effective, but are on average, more realistically, 91% effective in preventing pregnancy. This is because the pill must be taken at the same time every day to be its most effective. The hormones released stop ovulation and cause cervical mucus to thicken in efforts to prevent fertilization. It's important to consult a doctor before starting the pill because many other medications don't mix well if taken at the same time and can cause the birth control pill to stop working.
Common side effects can include changes in periods, sore breasts, again, similar to all other birth control that releases hormones. The oral contraceptive can cost from $0 to $50 depending on insurance.
Great! We have now covered the top 2 rows of our effectiveness chart. Let's get into this last row and really focus on what it takes for these methods to be their most effective. The diaphragm is a shallow, bendable cup that covers the cervix during vaginal sex and does not contain hormones, but uses spermicide to slow or even stop sperm from moving and reaching to an egg to fertilize. This method is 88% effective on average, as it does require to be inserted and used correctly with spermicide every single time someone has sex. It can be put in up to 2 hours before sex, and it can be taken out at least 6 hours after sex for the spermicide to work and for the diaphragm to be effective.
The diaphragm does require a prescription and can cost from $0 to $75. Common side effects of using the diaphragm come from the spermicide that is applied when using, which can irritate the vagina and make it more likely that you are at risk for an STI. But we can talk more about that when we focus on spermicide.
Now for one of our most popular contraceptives, the condom. Condoms are made out of a thin, stretchy material, either latex, a thin plastic, or lambskin, and prevent pregnancy and protect against STDs, except for lambskin condoms, as they do not protect against STDs such as HIV. The condom is worn on a penis during sex and keeps ejaculated sperm from entering a vagina. They are only 85% effective, as they must be used correctly and worn every time during sex during the whole duration of sex. When worn for the whole duration of sex, condoms can be a barrier for pre-ejaculate, which can transmit STIs and can rarely contain sperm to cause pregnancy.
Condoms are easy to get, as they are found in most convenience stores, grocery stores, and pharmacies, and they do not require prescription and are affordable. Now, condoms are compatible with other birth control methods, such as the ring, the pill, and other previously mentioned birth control methods, as they add an extra protection against unplanned pregnancy.
Condoms vary in brand and cost, but do not vary in effectiveness, as they all are FDA approved and have the same effectiveness no matter the cost. When you have a condom, check the expiration date before use and open with your fingers instead of scissors to make sure you do not damage the condom. Then pinch the tip of the condom and it should look like a hat. If you roll it down and it does not roll down smoothly, you might have it inside out on accident. Start over with a new condom or turn it around. Then roll the condom down the shaft of the penis all the way to the base and leave room at the tip of the condom for ejaculation. You can use lube when using condoms, but make sure it's water-based or silicone-based and not baby oil or Vaseline, because it can cause latex and thin plastics to split and break. Once all sexual activity is finished, hold the base of the condom to ensure nothing spills out. Then pinch the tip of the condom and take it off. And throw it away. Use a new condom every time you have sex, including vaginal, anal, and oral sex. Similar to external condoms, internal condoms protect against STIs and unplanned pregnancies. Alternatively, they do not go on a penis, but rather these internal condoms go inside a vagina or anus. They are a soft plastic pouch that inserts into a vagina to work as a barrier to stop sperm from reaching an egg. Internal condoms have been referred to as female condoms in the past. However, individuals of any gender can use them for protection during vaginal and anal sex. They are 79% effective due to needing to be inserted correctly every time before sex.
Internal condoms can cost from $0 to $3 per condom, but can be a little more difficult to find in stores compared to external condoms. Yet, Hillcrest has internal and external condoms available for anyone who's interested for free.
This next method was also mentioned as a popular method among that 15 to 19 age group, and it is withdrawal, also known as the pull-out method. This method includes pulling the penis out of the vagina before ejaculation and keeping ejaculant away from the partner's genitals to prevent any semen from getting in the vagina to fertilize an egg. Withdrawal is only 78% effective, as it must be done effectively every time before ejaculation to prevent pregnancy.
The plus side is it costs $0 and it works well with other birth control methods such as the ring, the pill, and the condoms to be more effective.
This next group of methods are referred to as lifestyle methods. They are fertility awareness methods. You may have also heard terms like natural family planning or the rhythm method. These methods include tracking a person with a vagina's menstrual cycle in order to plan to avoid sex or use a different birth control, such as condoms, during ovulation, that period when ovaries release an egg every month. Ovulation can be referred to as unsafe or the fertile days during these methods. These methods can be anywhere from 76 to 88% effective.
There are different strategies that can be used with FAMs that include taking your temperature every morning, checking cervical mucus often, and or charting your menstrual cycle on a calendar. Now, supplies can cost anywhere up to $20 depending on the supplies you choose to use, but there are free apps you can download on your phone that can help you track your menstrual cycle and ovulation. These next two methods are fairly similar. They are the sponge and the cervical cap.
The sponge is a small plastic sponge that is put in the vagina before sex. It contains spermicide to slow down sperm and also covers the cervix like a diaphragm would to prevent sperm from reaching the uterus. To use, you get the sponge wet with water before putting it in. It should be sudsy from the spermicide, and so you should not squeeze it dry before use.
You can put the sponge in 24 hours before sex, but be sure to check the expiration date before you use it. They usually come in a pack of 3 for $15, and they are 76 to 88% effective, but they must be used correctly every single time to be their most effective.
The cervical cap is exactly what it sounds like. It's a soft silicone cap that is put in the vagina before sex and covers the cervix. Similar to the diaphragm and the sponge, it is a barrier that stops sperm from joining with an egg and requires spermicide to be its most effective.
The cervical cap can cost from $0 to $90 depending on insurance. Now, different from the diaphragm, the cervical cap can be in the vagina for up to 2 days, yet the diaphragm is more likely to be effective. Now, the cervical cap, its effectiveness is a huge range from 71 to 86% effectiveness. So it is very important to use it correctly and consistently every single time to be its most effectiveness.
As mentioned previously, spermicide is a 71% effective method that can be used with other methods to increase effectiveness, or it can be used on its own. Spermicide is a cream or a gel that comes with the applicator that helps place spermicide at the back of the vagina to block the cervix and slows and stops the sperm from moving. Some spermicide needs about 10 to 15 minutes before sex to work. Many kinds only work for an hour and may require more to be used.
Using spermicide several times a day can cause vaginal irritation, which can break down the vaginal lining and can increase your risk for contracting an STI. So if spermicide does cause problems, it may be of interest to look into other birth control methods. Or if you are interested in spermicide, it costs from $0 to $8 depending on insurance.
Now we have reached our last form of birth control. Accidents happen. Whether you think a condom broke, maybe you forgot to take a few pills, or you forgot protection altogether, there is emergency contraception just for these scenarios. There are 3 different kinds of emergency contraception that people with vaginas can use to safely protect themselves from pregnancy after unprotected sex. The copper IUD protects against unplanned pregnancy when inserted within the first 5 days after unprotected sex, being the most effective emergency contraception at 99.9% effective. The copper IUD can last up to 12 years after the initial insertion, so it can be more than emergency contraception. Ella is an oral contraceptive pill that is taken once within the first 5 days after unprotected sex. It works best for those who weigh within 155 and 195 pounds at 85% effective. It costs between $0 to $90 and requires a prescription. So this method of emergency contraception works best if purchased before sex as a backup when needed. Ella can cause hormonal birth control to be less effective if taken within a few days of each other. So a different emergency contraceptive may work better if you use hormonal birth control as your regular birth control method. The last emergency contraception is the levonorgestrel pill, known by its brand names of Plan B, Take Action, My Way, and After Pill. They are all 75 to 88% effective and don't vary on effectiveness depending on the brand or the cost. They can be taken between 3 to 5 days after unprotected sex, yet these pills work best the sooner digested after unprotected sex, and also work better for people under 155 pounds.
There are pros and cons to all contraceptive methods. Something you may have recalled at the beginning of the video is that those methods were more likely to release hormones as their active ingredient in preventing pregnancy, and they were higher on the effectiveness chart. Yet there are those common side effects that can make it more difficult for certain types of bodies and certain people. So that's where methods that use spermicide may be more appealing, even though they are less effective. Remember that condoms can be used with most other birth control methods as an extra layer of protection. Even if you are using a contraceptive method to protect against unplanned pregnancy, or maybe you are in a same-sex relationship and unplanned pregnancy isn't even possible, you could still be at risk for an STI if you are sexually active. Being sexually active can include any kind of sexual relations with another person. This includes vaginal, anal, oral sex, and also close skin-to-skin contact. We want this to be clear because STIs can be transmitted from one person to another in more ways than one.
There are a few strategies to being sexually responsible to protect yourself and the people around you from STIs. To help, just remember A, B, C. A. Abstinence is still the most effective way to protect against STDs. B. Be faithful to one partner, also known as monogamy. Monogamy makes it easier to keep track of someone's sexual health and history. And C. Correctly and consistently use condoms during sexual encounters. Being sexually responsible can also include getting tested to know your status, using other barrier methods such as dental dams to protect against STDs during oral sex, communicating with your current and past partners if you have an STD, communicating which safe sex practices you'd like to engage in with your current partner, and avoiding risky drug use behaviors. It's important to communicate with a healthcare provider as openly and as often as possible regarding your sexual health and habits as well.
Contraception can be very helpful when used correctly and communicated about between sexual partners. Yet, there are times when birth control is used as a method within violence and abuse. It is not okay to pressure or force someone into getting a permanent procedure like a vasectomy or a tubal ligation when they don't want to. It is also not okay to refuse to use protection and then continue to pressure someone into having sex with you. It is not okay to not tell your partner that you have stopped using birth control when they believe you are still on birth control.
If you feel your safety is at risk, contact the Riverview Center for help and guidance. At Hillcrest, we provide free and confidential services, which include STD, hepatitis C, and HIV testing, hepatitis A and B immunizations, treatment for STDs, and referrals for HIV treatment, free condoms and lubricant, wound care kits, and other harm reduction supplies. You can call our cell at 563-513-6123 to schedule STD testing at our office on 2005 Asbury Road.
You may still have a lot of questions after today's video, but have no fear.
You can contact Hillcrest Family Services with any questions you have, and we will be happy to answer them for you. Otherwise, we encourage you reach out to a trusted adult when facing confusing or complicated subjects. If you decide to search online for more information, here are some trusted, credible resources about sexual health: sexetc.org, amaze.org, loveisrespect.org, Go Ask Alice, Planned Parenthood, and teenhealthmatters.org.
Thank you so much for watching this video. We really hope you enjoyed it, and we will be getting more Hillcrest videos out to you soon. So, bye!